Do you know if you have high blood pressure? Measurement of blood pressure at home is of more help in knowing if you are at high risk for a heart attack, stroke, heart failure, kidney failure, or dementia than blood pressure measurement taken in a doctor's office. Home measurement of blood pressure can help a healthcare professional know whether you have normal or high blood pressure and can help you control your blood pressure. Whether you are concerned about high blood pressure or currently have it, this video will help you decide if home blood pressure measurement is right for you. And if it is, this video will teach you how to do it properly. Remember, if you have any questions about home measurement of blood pressure, or you are unsure whether it is right for you, consult your healthcare professional. Experts believe if you are at risk for high blood pressure, you should measure your blood pressure at home. Now, taking your blood pressure at home in combination with blood pressure measurement in a healthcare professional's office can help signal if you have normal or high blood pressure, if you have a serious medical condition, and in turn, assist your healthcare professional in finding the appropriate treatments for you. Home measurement will also help you and your healthcare professional monitor your blood pressure as your lifestyle or your medication changes. Among the conditions home blood pressure measurement can help signal is white coat hypertension. This occurs when a person's blood pressure will be high when they see a healthcare professional, but will be normal at home. People with white coat hypertension do not have a higher risk of heart disease or stroke, but over time, some will develop true high blood pressure. Making good lifestyle changes can prevent high blood pressure from occurring. By continuing to measure blood pressure at home, people with white coat hypertension can help their healthcare professionals know if or when true high blood pressure develops. Another condition home blood pressure measurement can help signal is masked hypertension. This is the case with people whose blood pressure is normal when they see a healthcare professional, but is high at other times. People with masked hypertension do have a higher risk of heart disease and stroke, so they should continue to measure their blood pressure at home to help them and their healthcare professional determine if their blood pressure stays high. Regularly measuring your blood pressure at home is a great way to monitor your health. And for those of you with hypertension who sometimes forget to take their medication, it's a good reminder to take your medication to keep your blood pressure down. Make sure to contact your healthcare professional if your blood pressure readings are high. Most people can properly measure their blood pressure at home. For some, however, home blood pressure measurement makes them very nervous, or it may be a complicated task. It can be difficult for people with physical or mental disabilities, for instance. But friends, family members, or other caregivers can help. And some people with irregular heartbeats, such as atrial fibrillation, may have difficulty obtaining accurate blood pressure readings. If you have diabetes or kidney disease and want to measure your blood pressure at home, consult your healthcare professional. Sometimes your healthcare professional may also want to measure your blood pressure with a special monitor that you wear for a full day and night. These monitors can take about 50 readings in 24 hours and can help determine if your blood pressure is too high. If home blood pressure measurement makes you nervous, or if you have an irregular heartbeat, diabetes, or kidney disease, discuss this with your healthcare professional before purchasing a home measurement device. Blood pressure goes up and down depending on how you feel and your amount of physical activity. While these changes are normal, they can result in high blood pressure readings that mislead you. In order to determine if you have hypertension, your blood pressure should be properly measured at home when you're in a relaxed state. We will review the ideal conditions in which to take your blood pressure shortly. The first step towards measuring your blood pressure at home is purchasing a validated monitor. Newer types of equipment have made home blood pressure measurement not only easier, but more accurate than in the past. Next, you need to choose the right cuff size for your device. And finally, you must prepare for and measure your blood pressure properly. It is important to make sure you measure blood pressure properly so that your readings are accurate. Accurate reading measurements ensure your healthcare professional prescribes the most appropriate medications to help control your blood pressure. When blood pressure is not controlled, your risk of heart disease and stroke are markedly increased. If too many medications are prescribed, you may experience side effects. If your blood pressure changes often because you do not measure it properly, this will make it difficult to tell what your blood pressure usually is. In the next segment, we will show you how to choose the right equipment and accurately measure your blood pressure at home. It is important to buy a home blood pressure monitor that not only meets international accuracy standards, but is also suited to your needs. Remember to only buy monitors that have been tested and evaluated by the Canadian Hypertension Society. Just look for the Canadian Hypertension Society approved checkmark on the outside of the box. A checkmark on the box ensures that the device has been approved by the Canadian Hypertension Society. You can get more information at www.hypertension.ca. If you are purchasing the device from a pharmacy and are having trouble finding an approved device, please ask the pharmacist for assistance. Once you've found CHS-approved devices, the next important step is finding one with a blood pressure cuff that fits you properly. This is not as easy as it sounds. It is advisable to have your arm size checked and measured by a healthcare professional before you buy your monitor. This requires checking the size of your bare upper arm midway between the shoulder and elbow and writing it down. It is best to record the measurement in inches and in centimeters. Then, compare your arm size with the size of the chart on the box to ensure it fits. Most cuff size come in small, medium, and large. If you have a large arm, especially if it's also short, you may not be able to find a device that has a cuff size that will provide you with an accurate reading. When possible, try on the cuff at the store before buying the device. Home blood pressure monitors are either fully automatic or semi-automatic. The cuff on a fully automatic device works when you press a button. With a semi-automatic device, you must squeeze the bulb on the blood pressure cuff. While fully automatic devices are easier to use, they cost slightly more than the semi-automatic ones. You also have the option of purchasing a device with a computerized memory that stores blood pressure measurements. If you do purchase a device with a memory, be sure to delete readings from other people and those readings that were not done properly. Once you have purchased a home blood pressure monitor, carefully read and follow the enclosed instructions and make sure your cuff fits properly. Approved devices can provide readings that are wrong in some people if the cuff does not fit properly or if the devices are used incorrectly. Proper preparation is very important when using a home blood pressure monitor. If possible, have a healthcare professional watch you measure your blood pressure to make sure you are measuring properly. Once you have purchased a Hypertension Canada Society approved monitor with the right cuff size for your arm, you can properly prepare to measure your blood pressure at home by following this simple checklist. If you are in a rush, do not measure your blood pressure as it may result in a wrong or misleading reading. Measuring blood pressure without taking time to prepare properly usually results in readings that are far too high. Measure your blood pressure at the same time every morning or evening before taking medications or bathing. If you need to use the washroom, do so before measuring your blood pressure. A need to use the washroom increases your blood pressure. Be relaxed. Stress, pain, anxiety, and even talking can cause marked increases in blood pressure. Taking your blood pressure in these situations is not recommended. Choose a room that is quiet and has a comfortable temperature. Cool or cold temperatures, noise, and other distractions increase your blood pressure. Wait at least 2 hours after heavy physical activity or 30 minutes after light activity. Blood pressure increases during activity and then decreases for 30 minutes to 2 hours after vigorous activity. Wait at least 30 minutes after smoking or consuming caffeine. Blood pressure increases for a short time after smoking, chewing tobacco, or consuming food or drinks containing caffeine, such as coffee or tea, but comes down again in 30 minutes. Sit in a chair with your back supported and both of your feet flat on the floor. Use a pillow or a cushion to support your arm on a table to ensure that your arm is at heart level. If your back and arm are not supported properly, your arm is too low, or your legs are crossed, your blood pressure will increase and will get incorrect readings. Measure your blood pressure on a bare arm or through a shirt with a thin sleeve. Place the blood pressure cuff on your bare arm with the arterial marking or tube on the inside of your arm. The cuff should not be too snug or loose. 2 fingers should be able to fit under the cuff. There are different types of cuffs available. Please refer to the instruction manual included with your device for directions. Then, rest quietly for at least 5 minutes before taking your blood pressure measurement. It is important to take your time. Rest, relax, and sit comfortably for at least 5 minutes before taking the first measurement. Being rested and relaxed will ensure proper measurements. Now you are ready to measure your first blood pressure reading. If you are using a semi-automatic device, rapidly inflate the cuff with the bulb and read the blood pressure. If you are using an automatic device, push the button and wait for the blood pressure reading to appear. Sit quietly while the reading is in progress. Once the reading is complete, record it in your logbook. Then wait at least 1 full minute. Then take a second measurement and record that reading as well. Duplicate readings are important to know what your usual blood pressure is. If you get an error reading, check the device instructions to see what was wrong and start again. And if you get interrupted or are disturbed, start over again after resting for another 5 minutes or measure at a different time. It is best to keep your blood pressure readings recorded and organized, even if your device has a memory. Paper and electronic records can be downloaded and printed at www.hypertension.ca. Make sure to show your readings to your healthcare professional during each visit. Blood pressure can be measured either in your left or right arm. If you have different blood pressure readings in your arms, measure your blood pressure in the arm with the higher blood pressure and have your healthcare professional confirm the difference. Remember, if you don't have the time or there is no comfortable place to measure your blood pressure, do not do it. Though you can take some readings without preparation to show yourself how important proper preparation is. If you do this, do not record the readings. It's good to develop a routine time and way of measuring your blood pressure. It should be measured in the morning before taking blood pressure medications and in the evening before going to bed. If you get lots of errors, make a note and talk to your healthcare professional. If you have a calculator or use a computer to record your readings, average the morning readings and then average the evening readings. Record the average readings as well as each reading. To help your healthcare professional know if you have high blood pressure should be measured twice in the morning and twice in the evening for 7 days. Though the first day's readings are ignored, the average of the other 6 days is used to help determine whether you have high blood pressure or not. Still, record all of your blood pressure readings and do not remove high or low readings. If you already have high blood pressure, you should measure your blood pressure before each visit to a healthcare professional. It is best to take 2 readings in the morning and in the evening for 6 days just before each appointment. This will help your healthcare professional know how well your treatment is working. Measuring your blood pressure at home can also tell you if your changes to your medication are working. The largest decrease in blood pressure is usually less than 6 weeks after starting a blood pressure medication or increasing the dose. Measuring your blood pressure during the first 6 weeks following a medication change can determine if the change was helpful. 2 readings in the morning and 2 readings in the evening are advised. Home measurement of blood pressure can help you know if lifestyle changes are improving your blood pressure. Making positive lifestyle changes, such as improving your diet, increasing your physical activity, losing weight if you are overweight, and drinking less alcohol will help lower your blood pressure. A diet high in fresh fruits and vegetables and low-fat dairy products, but low in saturated fats and sodium or salt, is very important. Most people will see lower blood pressures within a few weeks of making lifestyle changes. In some people, bigger changes in lifestyle or a longer time is needed before blood pressure comes down. A home blood pressure monitor can show you these changes are working and will help you continue with a healthy lifestyle. Increases in blood pressure also occur if good lifestyle changes are stopped. Blood pressures taken at home are usually lower than in a doctor's office. If your usual blood pressure at home is 135 mm mercury systolic or higher, or 85 mm mercury diastolic or higher, this is considered high blood pressure. Blood pressures in your healthcare professional's office of 140 mm mercury systolic or higher, or 90 mm mercury diastolic or higher are considered high blood pressure. Average readings above these levels indicate you may be at increased risk of heart disease and stroke. If you have diabetes or kidney disease, your blood pressure should be lower. Be sure to discuss what your blood pressure should be with your healthcare professional. Sometimes your healthcare professional may also want to measure your blood pressure with a special monitor that you wear for a full day and night. These monitors can take about 50 readings in 24 hours and can help determine if your blood pressure is too high. It is important to know what to do if your blood pressure is too high or low after measuring it at home. If your blood pressure is unusually low and you feel faint or dizzy, call your healthcare professional for advice on how to change your treatment. Ask your healthcare professional to tell you what the dangerous upper limit is for you and for advice on what you should do if your blood pressure is too high. If you have shortness of breath, swelling of the legs, chest pain, loss of sensation in an arm or a leg, or an inability to speak, these may suggest diseases of the heart or a stroke, and you may need to get treatment right away, even if your blood pressure readings are normal. Remember, do not stop or change the way you take your medication without first checking with your healthcare professional. The Heart and Stroke Foundation at www.heartandstroke.ca/BP has an online program to help you with your blood pressure. This video has reviewed the recommended steps for purchasing and using a home measurement device properly. A summary of all the important steps are included in the next segment. It is important to properly follow these steps and to carefully read and follow the device instructions. If you have questions or trouble measuring your blood pressure or using your device, consult your healthcare professional for assistance. More information on home measurement of blood pressure can be found at www.hypertension.ca/BPC. Taking your blood pressure at home is easy to do if you follow a few simple steps. You need to prepare and do the reading correctly with a validated monitor and the proper size cuff for your arm. First, check with your healthcare professional to make sure measuring your blood pressure is reasonable for you. Some people with an irregular heartbeat, whose arm is large and short, who have physical disabilities, and who are very nervous may not be suited to measure blood pressure at home. Using the right equipment is very important. Make sure to check your arm size so that you can buy a device with the right sized cuff for you. You should buy a device that has been approved by the Canadian Hypertension Society. You can find this information at www.hypertension.ca. You can go to a pharmacy and look for devices with the CHS symbol. A validated monitor and the correct size cuff that fits you is very important. Once you purchase the device, make sure you can use it properly. Carefully read the instructions and, if possible, have a healthcare professional watch you measure your blood pressure to make sure you use the device correctly. Measure your blood pressure in the morning or evening before taking medications or bathing. Make sure to use the washroom if required, and wait at least 2 hours after heavy physical activity or 30 minutes after light activity, smoking, or caffeine. Do not measure if you are in pain, stressed, or anxious. Make sure the room is quiet with no distractions and that it is a comfortable temperature. You should be sitting in a chair with your back supported and your feet flat on the floor. Do not cross your legs. Place the blood pressure cuff on your bare arm with the artery marking or the tube on the inside of your arm. The cuff should be snug, not loose or tight. 2 fingers should be able to fit under the cuff. Support your arm so that the middle of the cuff is at heart level. Remember, you need to rest for at least 5 minutes before taking your blood pressure measurement. Now that you have been resting quietly for 5 minutes, it is time to take your first blood pressure reading. If you have a semi-automated device, rapidly inflate the cuff with the bulb. Sit quietly while the reading is in progress. If you have an automated device, push the button and wait for the reading. Once the reading is complete, write it down in your logbook. Wait 1 full minute and then take a second reading and record it as well. Duplicate readings are important to know what your usual blood pressure is. If you get an error reading, check the device instructions to see what was wrong and start again. If you get interrupted or are disturbed, start over again after resting for another 5 minutes or measure at a different time. Do not measure your blood pressure if you don't have time to do it correctly. Remember, more information on home measurement of blood pressure can be found at www.hypertension.ca/BPC.